us now, former CDC Director Dr. Robert Redfield. Good morning to you, and thank you for your time. As we learn more about Ebola, I think it's also important to point out the origins of this disease. Where does it come from, and why is it so deadly?
You know, it's a bat virus that intermittently crosses over to infect humans. Probably one of the ways that it does it most commonly is children, where, for example, will pick up fruit in the jungle that's been bitten because the bats find and bite the sweetest fruit, and then they can get infected from that. So it's not an easy virus to transmit human to human. Usually when people are really sick and people have close contact with those individuals, particularly healthcare professionals. I think there's been some misunderstanding a little in the press. This is not a type of virus that's going to cause a pandemic. That's not what these viruses do. That's more restricted to our respiratory pathogens, but it is causing a significant outbreak. This outbreak right now is now the third largest Ebola outbreak in the history of the world already, and it just started May 15th. So it has the potential to become quite a significant Ebola outbreak. I was the CDC director when we had the second largest Ebola outbreak in 2018 in the same region, with about 3,470 cases. So this is a significant issue, and we are concerned because of as you commented, this is an area that's been at conflict for over 25 years, and as a consequence of the conflict, there's over 1 million people that have been disengaged from their housing, that are migrating across borders. So this is going to be probably a significant outbreak that has the potential to go regional into South Sudan. I will lastly say that this is an area that has enormous experience. The DRC, this is their 17th Ebola outbreak since 1976. Uganda has a lot of experience also, less so, say, Sudan, and therefore more concern there. But these are highly experienced public health communities in responding to Ebola. But the real problem is the conflict. The fact that this is in a conflict zone is going to be a problem.
Right. And because of transmission, which you say is difficult person to person, but when the person is dead and it's either blood or bodily fluids, as I understand it, and the transport of that person is how it spreads, which comes into question. They're trying to get these deceased bodies out, which causes a greater challenge.
That's a real problem. And, that's one of the things we had to do. I had 3 Ebola outbreaks during my time as CDC director in the DRC. And one of the things we really worked hard is to educate the people that we didn't want them washing the body of the dead. Let that be done by the medical groups in the proper containment gear. But it was very hard, and a lot of cultural issues. And as you saw, a lot of the people, they want the bodies of their dead. And then you saw they burned down the hospital to go after the bodies of the dead. That's obviously a very dangerous thing to do, because those individuals, once they've died, are highly, highly infectious.
Real quick, I know I heard you say this is not a pandemic type threat, but we also know that diseases are an airplane ride away. We've seen the CDC now screening passengers at U.S. airports. From a health precautionary standpoint, what is necessary to make sure that a disease like this or any other doesn't come into the U.S.?
Yeah, I think CDC, again, I have a lot of confidence in them. I think they've made the appropriate recommendations. They have restricted travel from non-U.S. citizens from Sudan, Uganda, and the DRC at present. And then those individuals that are U.S. citizens, they've allowed them to come in, but they funneled them through initially it's Dulles Airport. They're going to be, I think, opening Atlanta Airport and then Houston Airport. And individuals that come from those areas will be screened by trained public health officials to look at them for risk assessments. And then they will be monitored fairly carefully by the public health community for the 21-day incubation period. It's possible we'll have a sporadic case here and there. We had Ford in the 2014 epidemic, but this is not going to be a major threat to the United States. It's going to be inconvenient for international travelers.
Understood. Dr. Redfield, thank you, sir, for your time.
Yeah, thanks a lot for having me. God bless you.
You too.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.